Do you have PTSD? Great question. Let's figure it out. Hey, I'm Dr. McCleary, licensed clinical psychologist and Navy veteran. And in this video, I'm going to ask you 6 questions. And if all the answers to these questions are yes, you very much might have PTSD. The first question that I want you to ask yourself is, well, when did the symptoms start? Did they start before, during, or after the trauma? If they started after the trauma, then we're getting somewhere. The next question that I have for you is, do you think about the trauma when you don't want to? Or does it seem to sometimes come out of nowhere? This includes nightmares related to your trauma. Now, it doesn't always have to be a replaying of what happened, but recurring themes of what happened during the trauma. The next question that I have for you is, do you avoid things that are related to your trauma? And this includes avoiding thinking about it, talking about it, feeling certain emotions that are related to your trauma. But not just that. Do you avoid people, places, situations related to your trauma? Basically, are you triggered by things that look like, smell like, taste like, sound like, feel like the trauma? Have you noticed that since the trauma happened, you start to look at yourself, other people, and the world differently? And not just differently, but in a negative way. The last question that I have for you is, have you noticed since after the trauma that your reaction to things have changed? So have you been having trouble sleeping or concentrating? Do you find yourself more vigilant than you used to be? Some people call this hypervigilance. And those are the 5 questions. If you answered yes to every one of those questions, you may have PTSD or may be suffering from some post-traumatic stress. Now, do answering these 5 questions and saying yes mean that you absolutely have PTSD? Well, no, because PTSD is a bit more complicated than that. If you want to learn more about what all the criteria of PTSD is, I made a video on that. There's actually 20 total symptoms of PTSD. And you have to meet certain symptoms in certain categories. So it's quite complex. It's not as easy as maybe some of us think the diagnosis of PTSD is. One person's PTSD can look totally different than another PTSD. So this is just a start. But if you did answer yes to all of those questions, what I suggest that you do is you reach out to a mental health professional so they can actually evaluate you. And more than just evaluate you, they can treat you so we can reduce some of those symptoms. Some of them we can make go away forever. Because PTSD does not have to be a life sentence for most people. You can get treatment for PTSD. And the first step is recognizing that you actually are suffering with some of these symptoms. Something to think about. If this video was helpful for you, and I hope that it was, please like it. Subscribe to my channel if you want to learn more about PTSD and mental health. But more important than that, if this video was helpful for you, then that means it could probably be helpful for another veteran or another friend or family member of a veteran. So I ask that you share it with them, because at the end of the day, that's really what all this is about. One veteran trying to help another.